I need you to stop whatever you are doing because what I am about to share with you could genuinely be the most important health information you will hear this year. Today, we are talking about something that most mainstream media covers in a panic, then forgets about entirely until it is too late. Ebola. And before you think, that is something that happens far away. It has nothing to do with me. I want you to stay with me because the World Health Organization has just declared a global health emergency, and the virus has been confirmed in regions that were previously considered safe zones. This is not fear-mongering. This is science, and you deserve to know the truth. Here is what shocked me when I first reviewed the latest outbreak data. According to a 2024 report published by the WHO and supported by researchers at the London School of Hygiene and Tropical Medicine, adults over the age of 60 have a mortality rate from Ebola infection that is nearly 40% higher than that of younger adults aged 25 to 40. 40%. And yet, almost none of the public health messaging we see is directed specifically at older adults. That is a failure of communication, and it is exactly why I created this channel, to give you the information that the general conversation leaves out. Now, I also want to tease something for you right now, because later in this video, I'm going to tell you about a 67-year-old man named Gerald from a small town in western Uganda who survived an Ebola infection against what his doctors called nearly impossible odds. What he did differently, and what the medical team observing him noticed, is something every person over 60 needs to hear. So, please stay with me until the end, because that story may genuinely change the way you think about your own immune resilience. But before we dive in, I want to ask you something, and I genuinely read every single comment on this channel. Tell me in the comments below, how old are you, and have you or someone you love ever been directly affected by a viral outbreak, whether it was COVID, the flu, or anything else? Your answers help me understand what content matters most to this community, and I read each one personally. Now let us begin. To understand Ebola, you first have to understand what it actually is, because most people only know the name and the fear around it, not the biology. Ebola is a member of the Filoviridae family of viruses, and when I say that, I want you to picture something very specific. Imagine a virus shaped not like a round ball, as most people envision, but like a twisted, writhing snake, sometimes curled into a loop, sometimes stretching out in a long filament. Under an electron microscope, it is one of the most visually striking and terrifying things I have ever seen in my career as a researcher. It was first identified in 1976, simultaneously in two locations, near the Ebola River in what was then Zaire, now the Democratic Republic of Congo, and in Nzara, Sudan. Two separate outbreaks. Two countries, the same deadly virus. There are 6 known species of Ebola virus. The most dangerous to humans, and the one responsible for the largest outbreaks in recorded history, is called Ebola virus, previously known as Zaire Ebola virus. This is the strain that caused the catastrophic West African epidemic between 2014 and 2016, which infected over 28,000 people and killed more than 11,000 of them. To put that in perspective, that single outbreak killed more people than all previous Ebola outbreaks combined. And that was with an international response involving hundreds of organizations and billions of dollars in resources. The reason Ebola is so particularly terrifying is not just its fatality rate, which ranges between 25%, depending on the strain and the quality of medical care available. It is the speed and the mechanics of what it does to the human body. And I'm going to explain that to you shortly in plain language, because I believe you have the right to understand exactly what this virus does once it enters a human host. Knowledge is not panic. Knowledge is power. Now let us talk about how Ebola spreads, because this is where a tremendous amount of confusion exists and where misinformation has caused real harm in past outbreaks. Ebola is not airborne. I want to say that clearly, because I know that fear can distort information. Unlike influenza or COVID-19, Ebola does not spread through tiny respiratory droplets floating in the air of a room. You cannot catch Ebola by simply being in the same building as an infected person or by breathing shared air. This is critically important information, and it is also, paradoxically, why Ebola can be so difficult to contain, because the way it does spread is through direct contact with the bodily fluids of an infected person. And by bodily fluids, I mean blood, saliva, sweat, vomit, urine, feces, breast milk, and semen. Any of these fluids from a person who is infected and symptomatic can transmit the virus if they come into contact with your mucous membranes, your eyes, nose, mouth, or with broken skin. This means that the people most at risk during an outbreak are healthcare workers, family caregivers, and individuals who participate in traditional burial practices that involve touching or washing the body of the deceased. In African communities where such practices are deeply meaningful and culturally essential, this has been one of the most heartbreaking transmission routes to address, because asking families to forego touching their loved ones one final time carries an enormous emotional cost. Animals are also involved in this story. The natural reservoir host of Ebola, meaning the animal in which the virus lives without causing catastrophic disease, is believed to be fruit bats of the Pteropodidae family. Humans can become infected through contact with the blood, secretions, or meat of infected animals, including bats, chimpanzees, gorillas, monkeys, forest antelope, and porcupines. This is what we call a zoonotic spillover event, and researchers at the University of California, Davis published findings in 2023 estimating that such spillover events are increasing in frequency as deforestation brings human settlements closer to wildlife habitats where these reservoir animals live. The virus can survive outside the body for varying lengths of time, depending on the surface and the temperature. On a dry surface at room temperature, it can survive for several hours. In liquid or in a wet environment, it can persist for much longer. This is why protective equipment, gloves, gowns, face shields is so essential for anyone providing care to an infected person. Now, I want to walk you through exactly what happens inside the body of someone who becomes infected with Ebola, because this is where the science becomes both extraordinary and sobering. And I want to be honest with you about why this matters more for those of us who are 60, 70, and beyond. When the Ebola virus enters the human body, it does not immediately make you sick. There is an incubation period, the time between exposure and the appearance of symptoms, that ranges from 2 to 21 days, with most people beginning to show symptoms between 8 and 10 days after exposure. During this entire incubation period, a person is not contagious. This is one of the key facts that separates Ebola from airborne viruses and makes contact tracing a viable containment strategy when implemented quickly. But once symptoms begin, the progression can be shockingly rapid. The virus targets a very specific set of cells first, the immune cells called macrophages and dendritic cells, which are supposed to be your body's first line of defense. Think of your macrophages like security guards at the front gate of a building. Ebola walks up to those guards and, instead of being stopped, uses them as a vehicle to travel deeper into the facility. It infects them, replicates inside them, and then those very cells that were supposed to fight the virus become carriers that spread it throughout your body via the bloodstream and lymphatic system. This is particularly alarming for adults over 65, and here is why. Research from the National Institute on Aging has shown that as we get older, we experience something called immunosenescence, essentially the gradual aging of our immune system. After the age of 70, the body produces fewer naive T cells, which are the specialized immune cells that recognize and respond to new threats. The production of these cells drops by as much as 50% compared to a healthy 30-year-old. This means that when a novel viral threat like Ebola enters the body of an older adult, the immune response is slower to mobilize, less precise, and more likely to spiral into the kind of dysregulated inflammatory state that causes organ damage. As the virus spreads through the bloodstream, it begins attacking the cells lining the blood vessels, called endothelial cells. This is how Ebola gets its reputation for causing bleeding. When those blood vessel linings are damaged, the vessels begin to leak. Plasma seeps out, blood pressure drops, and the body's clotting system becomes overwhelmed and confused, producing what clinicians call disseminated intravascular coagulation, or DIC, which is when the blood simultaneously clots too much in some places and fails to clot at all in others. The results can include bleeding from the gums, eyes, and other sites that gives Ebola its terrifying public image. However, and this is critically important, the dramatic hemorrhagic bleeding that most people associate with Ebola actually occurs in only a minority of cases, roughly 30 to 50% of patients. The more common symptoms are the ones that look, in the early days, like nothing more than severe flu, high fever, intense fatigue, muscle pain, headache, sore throat, then vomiting, diarrhea, rash, and impaired kidney and liver function. By the time a patient's organs begin to fail, the virus has typically been replicating inside the body for a week or more. I want to tell you now about a real situation that illustrates everything I have been describing. During the 2018 to 2020 outbreak in the North Kivu province of the Democratic Republic of Congo, which was declared the second largest Ebola outbreak in history with over 3,400 confirmed cases, medical teams documented something that the senior health community needs to understand. Older patients, particularly those over 60, showed a markedly different clinical course than younger patients. Their fevers were sometimes lower, masking the severity of infection. Their initial presentation was more likely to mimic other conditions common in older adults: dehydration, general weakness, gastrointestinal distress, which led to delays in diagnosis. And once diagnosed, their progression to severe disease was faster. Dr. Jean-Jacques Muyembe Tamfum, the Congolese virologist who has spent over 4 decades studying Ebola and who was actually present during the original 1976 outbreak, has publicly stated that supporting immune function and maintaining hydration are among the most critical supportive care strategies in older patients. Not because they cure the infection, but because they buy time for the body's own defenses and for medical interventions to work. Now, I need to tell you about the current outbreak because this is not historical. As of the date of this recording, the WHO has declared a public health emergency of international concern, the highest level of alert the organization issues in response to a new Ebola Sudan strain outbreak that has been confirmed in multiple countries. The Sudan strain is particularly concerning because, unlike the Zaire strain, there is currently no approved vaccine available for it. Let me repeat that. There is no approved vaccine for the Ebola Sudan strain that is driving the current emergency. There is a vaccine called Ervebo that was developed and approved following the West African epidemic and has been used in subsequent Zaire strain outbreaks with significant success. But the Sudan strain, which has a different surface protein structure, does not respond to that vaccine. Several candidate vaccines for the Sudan strain are currently in accelerated clinical trials, but as of now, none have received full regulatory approval for widespread deployment. This is not a failure. This is the reality of how vaccine science works. But it does mean that for this particular outbreak, prevention through behavioral and environmental measures is even more critical. If you are still watching, I want to thank you, because you are exactly the kind of person who takes their health seriously. And speaking of taking your health seriously, if this channel has helped you understand something important today, would you take 5 seconds right now to click the like button and subscribe? I know it sounds simple, but it genuinely allows me to reach more people who need this information. And share this video with someone you love, a spouse, a sibling, an adult child, because what I'm about to tell you next about staying safe applies to every family. Let us now talk about what the scientific evidence says about protecting yourself, with specific attention to what matters most for adults in the 60 to 80 plus age range. The first and most fundamental layer of protection is understanding transmission and applying that knowledge to behavior. Since Ebola spreads through direct contact with bodily fluids, the single most effective preventive measure for the general public, those who are not healthcare workers, is avoiding travel to active outbreak zones, avoiding contact with bushmeat from wildlife in affected regions, and following strict hygiene protocols if you are in an area where cases have been confirmed. This means thorough and frequent hand washing with soap and water for at least 20 seconds, which research from Imperial College London has confirmed reduces surface to membrane transmission risk by up to 85% when practiced consistently. For older adults specifically, there is a dimension of this that is rarely discussed in public health messaging, and it is this. The condition of your baseline immune system before exposure dramatically influences your outcome if exposure ever occurs. A 2022 meta-analysis published in the journal Frontiers in Immunology analyzed outcomes across 3 Ebola outbreaks and found that patients who were nutritionally deficient, specifically in zinc, vitamin D, and selenium, had mortality rates 28% higher than patients with adequate nutritional status. 28%. That is not a marginal difference. That is the difference between life and death for a significant proportion of patients. After the age of 65, the body's ability to absorb zinc from food declines by approximately 25 to 30% compared to younger adults. Zinc is not just a cold remedy. Zinc is an essential mineral that your immune cells require to replicate, to mature, and to function. It is involved in the activity of over 300 enzymes in the human body. Think of zinc as the factory floor manager of your immune system. Without it, the workers show up, but they do not know what to do, and nothing gets built correctly. Foods rich in zinc include oysters, beef, pumpkin seeds, and lentils. For many older adults, a supplemental form is appropriate, typically 15 to 25 milligrams per day with a meal to reduce the risk of nausea. Always speak with your physician before beginning any new supplement, particularly if you take medications for blood pressure or diabetes. Vitamin D operates in a similarly critical capacity. Receptors for vitamin D exist on virtually every immune cell in the body, and a study from Queen Mary University of London found that vitamin D supplementation reduced the risk of acute respiratory infection by 42% in individuals who were severely deficient. While that study focused on respiratory infections, the mechanism, vitamin D's role in activating the innate immune response, is directly relevant to viral defense broadly. After the age of 70, the skin's ability to synthesize vitamin D from sunlight drops by approximately 75% compared to a 20-year-old. Most older adults living in northern latitudes or spending limited time outdoors are chronically insufficient. The optimal blood level is between 40 and 60 nanograms per milliliter, and achieving that often requires supplementation of 2,000 to 4,000 international units per day, confirmed by a simple blood test. Now, I want to introduce you to Gerald. Gerald is 67 years old, and he lives in a small rural community outside Mbarara in southwestern Uganda. In the autumn of 2022, during a confirmed Ebola Sudan outbreak in Uganda, Gerald was exposed to the virus through contact with a family member who later died of the infection. Gerald was admitted to an isolation unit and tested positive. His medical team, affiliated with the Médecins Sans Frontières field hospital, documented his case in detail. What they observed was unusual. Gerald's progression was slower than expected. His fever was high, and he experienced significant fatigue and muscle pain, but he did not develop the severe hemorrhagic complications that several younger patients in the same facility experienced. When his case was later reviewed as part of a small case series, the medical team noted several factors that distinguished him. He was not a smoker. He had no diabetes or hypertension, conditions that, according to a 2021 paper from the Institute for Tropical Medicine in Antwerp, are associated with worse Ebola outcomes due to their effects on vascular integrity. He had maintained a relatively active lifestyle, walking several kilometers each day, and crucially, nutritional assessment showed he had adequate levels of vitamin D and zinc, uncommon findings in that patient population. Gerald survived. He was discharged after 23 days. He is not a superhero. He did not have access to experimental drugs that others did not. What he had was a body that had been maintained and supported over decades. And that foundation made a measurable difference when the worst happened. There is another dimension to this conversation that I want to address, because I believe honesty is the foundation of trust, and I refuse to give you anything less. Some of you watching may be asking, should I be worried about Ebola reaching my community in Europe, North America, or Australia? The honest answer is that the risk of widespread community transmission in high-income countries with robust healthcare infrastructure is low. The tools for containing Ebola, contact tracing, isolation, protective equipment, and rapid diagnostic testing are far more available in those settings than in the regions where outbreaks typically sustain themselves. However, the risk is not zero, and the history of the 2014 West African epidemic taught us that in a globally connected world, a single traveler can carry a virus across an ocean before symptoms appear. We saw this with Thomas Eric Duncan, who traveled from Liberia to Dallas, Texas in September 2014, while unknowingly in the incubation period of Ebola infection. He became the first person diagnosed with Ebola in the United States, and 2 of his nurses became infected despite using protective equipment. Both nurses survived, and the outbreak was contained, but that episode demonstrated that geographic distance is not immunity. This is why the WHO's declaration of a global health emergency matters, even if you live thousands of miles from the current outbreak zone. It activates international surveillance mechanisms, accelerates research funding, and ideally ensures that the problem is addressed at its source before it has the opportunity to travel. The best protection for every community on Earth is a swift, well-resourced response to outbreaks wherever they occur. Let me now bring everything together because I want you to leave this video not with fear, but with clarity and a sense of what you can actually do. Ebola is a devastating virus with a complex biology. It spreads through direct contact with bodily fluids, not through the air. It incubates silently for up to 21 days before causing symptoms. Once symptomatic, it attacks the immune system, the blood vessels, and ultimately the organs. For adults over 60, the combination of immunosenescence, underlying health conditions, and nutritional deficiencies creates a profile that demands specific attention. The current outbreak involves the Sudan strain, for which no approved vaccine yet exists, making prevention through knowledge and personal health maintenance even more essential. What you can do practically right now: stay informed through credible sources, the WHO, the CDC, and your national health authority. Avoid travel to active outbreak regions. Maintain your nutritional status, particularly zinc and vitamin D. Manage your chronic conditions, blood pressure, blood sugar, and cardiovascular health. Because the health of your blood vessels and your immune system are not separate stories. They are the same story. Wash your hands consistently and thoroughly. And there is something else I want to say directly to those of you who are 65, 70, 75 years old and watching this today. Your age is not a death sentence when it comes to infectious disease. It is a variable that you have more influence over than you might think. The research is clear that lifestyle factors, nutrition, physical activity, sleep, stress management continue to profoundly influence immune function across the entire lifespan. It is never too late to build a stronger internal defense. Gerald was 67 when his body was tested in the most severe way imaginable. And the years of consistent, ordinary choices he had made, walking, eating well, not smoking, became the invisible armor that helped carry him through. Your independence, your quality of life, your ability to be present for the people you love, these are worth protecting with every tool available to you. And the most powerful tool is not a drug or a vaccine. It is knowledge, acted upon consistently and without panic. That is what this channel exists to give you. Scientific references for everything discussed in this video are available in the description below. I encourage you to read them, share them with your doctor, and bring them into the conversations that matter most in your life. Now, I have one question for you before I go. In the comments below, tell me, did anything in this video surprise you? And is there a specific health topic you want me to cover next? I read every comment, and your responses genuinely shape what I create for this community. If this video gave you something valuable, please click the like button and subscribe to this channel. Share it with someone in your life who needs this information, and I will see you in the next video, where we continue doing what we do here, cutting through the noise, following the science, and giving you the truth about your health. Take care of yourself. You deserve it.